be able to look at the real issues, where they come from, who's most impacted. How does policy then get formulated or changed in order to address this? And how do we work together as public sector, as private sector, to ensure that we are implementing policy in an effective way?
One answer, short answer, no. You know, if you think about the World Health Organization, and one of my presentations actually has a tweet that was sent out from WHO saying that the coronavirus is not airborne. And, you know, I'm a scientist, I have a doctorate, and my specialty is looking at people's exposure to health hazards in workplaces. And we spent a lot of time talking about this in Canada with my network. And I also wrote a letter to Theresa Tam. She's the health expert, public health expert in Canada, just to try and talk to her. And I did this on behalf of Workplace Health Without Borders. So Workplace Health Without Borders have 15 now. They have 15 boards of people on the board, 15 directors. We have a lot of expertise. We've run probably about 12 webinars. We've had world experts like Professor Lydia Morawska, who headed up the letter with 239 scientists to the World Health Organization to get them to reconsider their position about the coronavirus being airborne. Slowly things are changing. They're starting to talk about ventilation, but it is so disparate. It is a global problem, like it's a real global problem. This message needs to be consistent. People need to think about the coronavirus floating around in the air. What extra things do they need to do to stop being exposed to what they could be breathing in? The problem is that the infection control science paradigm experts, it's based on very old literature, very old information. And what I've found is occupational health scientists, occupational hygienists have been marginalized. You know, our voice isn't being listened to, but this is what our skill set is. We're actually trained to do this. So I think I still believe there's a lot of disparity in the messaging that's going out around the world, and I think that needs to be fixed.
Well, you know, one of the things that we see in the US, and that is true in most parts of the world, is that while there is availability of healthcare in places like the US, there are unfortunately disparities in healthcare where one's accessibility to healthcare is unfortunately often based on one's zip code, where one lives, and what kind of income a person has. That's why there's such a move now in the US, and hopefully will become even stronger now that we have elected a new president and a new vice president, where we will go build upon the Affordable Care Act that was enacted by President Obama, which was designed to make sure that we could eradicate some of the health disparities that exist in our system. You know, the world has an unfortunately short memory. During times of crisis, we talk philosophically, we talk theologically, and we talk scientifically and emotionally about unity and harmony and togetherness. And then when we move out of a crisis period to a more normalized time, people tend to forget about what they should have learned in the middle of the crisis. What I'm hoping will happen with COVID-19 is, because we see so much the interconnectivity and global nature of this pandemic, that the world will not allow itself to go back to a selected amnesia and forget the necessity for us to work together. So organizations like the African Union, like the Organization of American States, the alliances in Asia and the European Union, it's important for NGOs to be the consciousness of governments. It's important for a free press with journalists who have the power and the authority and the courage to critique their governments and to become a moral voice, demanding that governments never again return to the kind of systems where there is a disparity in healthcare, or where there's an absolute non-availability in healthcare in some parts of the world. You know, in the next 20 years, or maybe even shorter, 1 out of every 4 people on planet Earth under the age of 35 will be an African from the African continent, which means that we're reaching a point in the world population, in the demographics of the world, that in order for industry to survive, in order for scientific ingenuity to survive, for economies to survive, it's going to depend upon recognizing a way to integrate African skill sets, African scientific and orientation, and African people into the marketplace of ideas that will be created industries so that the rest of the world can survive. It's important for us to recognize our global connection. And if we fail to do so, it would be a shame upon us and a shame upon the world in which we live.